There we go. Thank you. So today we're going to talk about what's going on with Project Echo. You guys know what's going on with integrated care. You guys are with us at most Fridays, and sometimes we can get siloed and forget like what all is going on with the model and the project, and it is a global movement. So I think it's really awesome to get to highlight some of the things that are happening outside of the integrated care world. So this is a great look at what was good numbers at the end of 2022. I expect we'll get some numbers about 23 in the first quarter of next year. But as you can look here, the project is reaching a lot of people. And it's fantastic that we are included in these numbers. So
I actually heard yesterday that Hubs is now up to over 1,100.
That's quite a bit. And I think there are more than 33 super hubs now as well. I know there was at least 5 new ones coming on board this year. And so that just means you guys get to be part of this really amazing global movement that helps serve underserved communities and bringing best practices and promised practices to your communities and patients. You're here, so you're allowed to add anything if you want.
I will.
As we are here with integrated care, the project has been adapted to multiple different facets. So this is just a glimpse of what the project has started to touch. We're talking about early childhood educators are tuning into Project Echo and using that model for their students and their social emotional learning awareness. It's also being used for climate change and conservation in an environmental way, which is a really interesting application. Also public safety, and that's a new one for me, and we get to tune into a little bit as we are about to launch the Deflection Echo in February. That's housed within the Criminal Justice Coordinating Center of Excellence, but there's also other ones out there in the world that are helping with the public safety and all of the community parts of that. Also, in regarding the world universal challenges, public health is huge. Everybody knows that we could use each other, a community, and be able to lean in to each other to continue sharing best practices. Also with that, since Project Echo has been around for 20 years now, the World Health Organization is starting to recognize that, hey, we know what we're doing in the digital world of being able to bring people together from all different parts of the world and learn from each other. So it was announced in September that the WHO is going to partner with the Project Echo Institute to establish the Center for Digital Learning and Health Emergencies. They saw that with the COVID response, how easy Project Echo was to get things rolling to address the needs in the COVID times. They're also addressing that for Ukraine and for Sudan. So in countries that are in crisis, Project Echo can help put things in place for the public health emergencies and the response for the workforce capacity. So transitioning just a little bit more specific things that we take tidbits from that would be relevant to the integrated care world is this wonderful resource that was developed by a behavioral health professional workforce resilience echo program. And this is also a plug because our chair of the department is part of that hub for that echo program. So they developed this workbook, and the link here that you see, if you click that when you receive the slides today, you can download a digital copy for free.
A little bit of an extra plug for the program. I have attended as a participant. It is a very neat group, and it started out as behavioral health professional workforce, but it really has expanded to anybody who's interested in coming. So anybody who's potentially needs to build resilience in a good community that works in the field of healthcare in any stretch, they are more than welcoming to anyone that joins. And it's That one's on Monday afternoons, if anyone's ever interested.
Nicole can share the links. I'm not sure when that one is going to be moved to the new iEcho, but once it is, it'll be really easy for you guys to sign up and tune into that. And maybe Nicole, you can ask at the next session that you attend.
Yeah, I will definitely ask, and I'll share the information on how to sign up in the meantime.
Perfect. Yes, awesome, Amy. Yeah, it will be available in the slides when you get that email. That link there will take you right there. When I'm done presenting, I'll also just go ahead and throw that in the chat so you don't necessarily have to wait for that email to come through. This one is a personal favorite for me. Is this a case presentation? So I know sometimes we have a little bit of resistance to have necessarily a case about a participant or an individual prepared ahead of time and make sure it's a clinical type case. Within this model, it is not required that it is a clinical patient. It can be a barrier that you're reaching in, that you experience in your community. And I'm going to plug here also for Amy Lacrix, because I think you're not driving today and you can share that barrier that you're experiencing in your community. And we've done this before, and Pedro Ballester is really good at asking a question. Just a cue will do, because it usually means there's something else behind there that we all can teach and learn from each other. And also, what does your community or practice need? You heard me discuss that there's going to be deflection echo, and it's going to be in regards to quick response teams that are a public facing response. And yes, if you want to know how your community has, if they have a QRT and how to get one started, you know, that would be something that you could ask, and it is considered a case within the model. I also like to mention, we talked about in this session that I attended about an SBAR, where when you're thinking about a case or something to bring to discuss, that it's about just figure out the situation, what the background of that situation is, what your assessment is of that situation, and what kind of recommendations are you looking for.
Okay, so there's a couple sessions that I attended so at the MedEcho, I ended up being very interested in really two major topic areas. One, the new iEcho, which we talked about a bit last week. And if anybody has questions, we can always go back to that. The other was really about evaluation, because some echo programs are housed within medical systems or university connected hospital systems. Some are even attached to accountable care organizations. So they're able to get really cool data, being able to show not only provider level changes and practice changes, but things like actual patient outcomes. And with the way that NeoMed is structured, we're kind of different. So we don't have that. And I'm not a researcher by any kind of training or background. And yet I know that it's important for us to do something to be able to prove that what we're doing is valuable and good, in case anybody ever questions, you know, why are they funding us and why are they allowing us to continue down this path? We want to be able to prove that it's worth it. So one of the sessions that I attended that had some really interesting way of looking at evaluation was actually it was a presentation by a group who does an echo for lung diseases in minors, MINERS, not ORS. So super interesting, very far outside of my field, but it seemed like they had some interesting assessment and evaluation ideas. So one of the things that they did is they actually assessed, well, they did the two that I want to talk about, but this slide kind of focuses on one, is they assessed changes in knowledge, self-reported changes in self-efficacy, and then collective efficacy and knowledge transfer among network participants. So the graph or chart on the left looks at that knowledge transfer among network participants, and they were asking folks, so who are you getting potential information from? Where are you getting new and unique information from in terms of other professions that you're interacting with on this ECHO program? And the experienced participants, so that those who had been attending longer, reported higher number of knowledge sources than did newer participants. And more than half of the sources of new information was actually outside of their professional affiliation. So when you look at that, I don't know what kind of chart that's called, Sarah, if you know, you could fill me in. But basically the size of the circle with each color shows you how much that particular profession was tapped into as a particularly novel knowledge source. So if you see the on there, it's clinicians, yes, but also the benefits counselors, so that's that dark blue, and attorneys being that the bright purple. So out of all of the clinicians who were attending, and they really wanted to be able to do better respiratory illness management for their patients, they were getting more information from benefits counselors and attorneys that was extremely valuable to them and that they needed. So really being able to tap into the interprofessionality and multidisciplinary aspect of Project Echo. The other thing that they looked at that I thought was super interesting and something that would be neat to look at amongst this group is actually collective efficacy. So they had taken this measure, which had been used in other types of studies, and then took several of the items and asked people in the learning community to rate as, you know, where on the scale from disagree to strongly agree, how willing do you think the community is to help other members? How people in this learning community build respect for one another's particular interest, are willing to help improve each other's patient care, find and share resources with one another, whether it's a close-knit learning community, generally get along, foster all members' ability to care for patients, whether the learning community can be trusted, manages conflicts of interest well, and would intervene if a fellow member is arriving at the wrong conclusion, and support each other in times of stress. So being able to see that the folks in this particular ECHO community were really found a strong sense of self-efficacy, which I think is even more interesting than those self-reported changes in individual self-efficacy and individual confidence in a different practice. Just wanted to share that because I thought it was kind of cool.
As most of you attended last week's session, and we talked about the new iEcho. We have some folks here who were not able to be with us, and I kept these slides in just in case of that. You have received an email. Most of you have been able to sign into that new system starting in January. So next year, just a couple weeks from now, when we meet on Fridays, we'll be meeting through that new iEcho system. So I will be available this afternoon. I work on Tuesday and Wednesday of next week. So if you guys have questions, feel free to reach out. I'm happy to help make sure you're set up for that first Friday in January. And just a quick overview again of what that new iEcho is. It is an all-in-one platform for all things Echo. So you can also use an app. So if you're traveling and you need to tune in on Fridays from your phone or from a device, I would highly recommend that you go ahead and add this app to that device because it will make it easy for you, because there will not be an email from me. I should have said something in this Friday's reminder of like, oh, it's the last one I have to send.
Except that you should probably send the one that's in next, you know,
I
in
will.
January.
There
in
will be
addition
different
to-
communications,
Yes.
so I'll still be communicating with you all. But the link to attend the program will be within the platform. And for any of those who did not attend last week, we did record that session. However, I am going to tweak a few things and I'm presenting on it on Wednesday of next week. So that recording will be available by Tuesday afternoon. So you can watch that and also go through the materials that were emailed to you.
I would suggest I've downloaded the app. What's neat about it is that, yeah, you get the 30-minute advance email saying, hey, the session's going to start in 30 minutes. But if you have the app, it also you can allow it to send you push notifications so that you'll then get that on your phone too, saying, hey, your session's about to start. And then you can access all of the materials through the app as well.
And again, just a quick overview as to why and what the benefits are. The why is, the Project Echo Institute developed this. Their goal is to reach 1 billion lives by 2025. And as you saw on the first slide, we're just over 4 million. So we got 6 million more to go. And one way to be able to connect people who like Project Echo within the platform, you can search for other programs that are within the system. So Amy, our pediatrician, there are specific pediatric echoes available to you that are public. We don't know them all because it's a fast moving, ever growing movement that if you use the search bar within this platform, you'll be able to see which ones are open to you and if you can join those and be able to sign up and tune into new other networks that will help you. It's fully integrated with Zoom. So when you tune in that first Friday of January, it's going to look just like this. The only thing that looks different is how you get there. You'll get the automated reminders in your email. Sometimes they're like, oh, the session starts in 23 minutes. It really is kind of interesting, but you will get it before it is 12 o'clock. You'll be able to submit assessments and feedback. You'll also be able to have access to all of the content within the program. So if you missed last week, the slides will be in there. So you don't have to go back and say, hey, Jamie, I need the slides for this one. It'll be a lot faster to retrieve those resources. Anything else?
Just obviously, you can't always continue to email us asking for those things, but they'll be there at, they'll be within your reach, probably more rapidly than we have the capacity to reply to emails. And we did hear from somebody just this week that they've been involved with another Echoes, and when they logged in this week, the first thing that was said was, I love this. I love this. This makes it so much easier. So we're getting positive reviews from users.
And that is all we were going to share with you guys today. So we'll open it up for questions, and I will get busy sharing some links in the chat box here.